So you've heard now from Dr. Merson and myself, but we wanted to give students a chance to say something about what the certificate has meant to them. We asked for proposals to speak at this graduation ceremony, and we were delighted to choose Lisa Deng. Lisa is a biology major who is committed to global health throughout her career at Duke. Her summer fieldwork experience included training teachers at a preparatory school in Uganda. And last year she co-authored a journal article about nursing care for AIDS patients in Africa. Lisa has been recognized well beyond Duke and was just recently selected for a Fulbright scholarship and will be doing research in Malaysia next fall. Lisa, it's all yours.
Family, friends, professors, and staff, thank you so much for being here today and for supporting us through all of these years. And to my global health friends, we did it. From wherever our journey started, we took courses that challenged us to think critically. We engaged in fieldwork that exposed us to the raw intensity of life. And we came home to lead our lives with a new understanding of who we are and our world. When I think about the opportunities that we've been given, I am amazed at how lucky we truly are. Interestingly, in a field where we study disparity, we're forced to confront the reality that we lie on the spectrum of plenty. And this raises difficult questions. How do we understand our own privilege? And what assumptions do we make about others? And how does our privilege impact our relationship with those who we want to serve? When I was in India last summer for my fieldwork project, I met a young woman named Reshma in a hospital. She was admitted for over 7 months for burns that covered 65% of her body. She was just 23 years old and a mother of 3. It was suspected that her husband and her mother-in-law had burned her due to dowry-related violence in India. And like many cases of domestic violence in a rural area in India, no charges were filed against her perpetrators. Every day after work, I visited Reshma in the unit where she stayed alone. And while we could only speak a few phrases of each other's languages, we connected in such meaningful ways. We shared Hindi songs and English songs. We painted pictures and even danced to cell phone tunes. And I grew to know Reshma as a compassionate woman with a strong will and keen intelligence. But even though Reshma was happier with company, she attempted to commit suicide twice before I left. And I realized that her emotional wounds were healing slower than her physical ones. And I knew little about suffering before I had met her. In Reshma, I saw the millions of women who undergo domestic violence in the world today, and the young daughters who are married off, and all the baby girls who were never given a chance. So what set me apart from women like her? Why was I born in a world with so much privilege, and her into a world where she was treated with such cruelty? Privilege is a tricky creature. Sometimes it overwhelms us with guilt. And other times we simply forget that it exists. And occasionally we secretly feel better than others because of our education, material goods, or where we're from. As we receive our certificates in global health today, and as we leave Duke to write the rest of our lives, we are again forced to evaluate what we have been given and ask ourselves, what will we do with it? It is all too easy to make our lives simply about accruing more of what we already have, whether that may be knowledge, money, or experience. It is all too tempting to make global health about publishing that next paper, or winning that grant money, or winning that policy debate. But let's not let it become that. What we do with everything we accumulate and who we use our knowledge for matters. When we get our degrees in law and medicine, when we start our businesses and NGOs, it is important to remember the people who are still suffering from injustice and inequity. Don't let the faces and stories that moved you and resonated with the core of your humanity. Let the privilege given to you by the people who love you, by the professors who've imparted you with their wisdom, and by the people who let you into their homes and their lives in your field work, not be wasted. In the words of Dr. Shobha Aroli, a physician that I met in India, you have been entrusted with great knowledge and power. So don't hoard it, share it, and use it to bring about good in this world. Thank you.
Lisa, that was truly a profound speech. Thank you for sharing that with us.